right, so without any further ado, we'll go ahead and get started. We'll introduce some more people along the way. And my name's Dr. Jay Hartley. I'm a 92 Palmer Davenport graduate, and I've had quite a journey from graduating from Palmer in 1992. I got my diplomate in neurology in 1995, moved back to St. Augustine in 96, and I was named a fellow of the Palmer Academy of Chiropractic in 2011. And then I had a life-changing experience where my daughter had progressive scoliosis, and we went up to the CLEAR Institute in St. Cloud, Minnesota, and saw Dennis Wogan, and I was really impressed with what he was doing. And so I have severe scoliosis myself, and my daughter got good results, and then I went there myself as a patient, and it was a life-transforming experience for me. And so then we opened up a clinic specifically geared toward scoliosis. So I want to share a lot of the stuff I've learned along the way. And so I got certified in CLEAR and then intensive care. Intensive care is where patients will come from other states and countries for 2 weeks and have their scoliosis worked on, and then they'll go back home. And then I became a Scolibrace provider, where if anybody here does CVP, they probably heard about Scolibrace. It's a three-dimensional scoliosis brace that is a big step up from traditional scoliosis bracing. But our roots are with chiropractic philosophy, right? And Dr. Fogarty, we know the fountainhead is Palmer College of Chiropractic in Davenport, Iowa, right? Chiropractors work with the subtle substance of the soul. We release the imprisoned impulse, the teeny rivulet of force that emanates from the mind and flows over the nerves to the cells and stirs them into life. We deal with the magic power that transforms common food into living, loving, thinking clay that robes the earth with beauty and hues and scents, the power with the glory of the air. In the dim, dark distance long ago, when the sun first bellowed to the morning star, this power spoke and there was life. It quickened the slime of the sea and dust of the earth and drove the cell to union with its fellows in countless living forms. Through eons of time, it finned the fish and winged the bird and fanged the beast. When I was at Palmer, I would go into the library and read that, and I would be like, man, this is something special. It was awesome. Endlessly it worked, evolving its forms until it produced the crowning glory of them all. With tireless energy, it blows the bubble of each individual life, and then silently, relentlessly dissolves the form, absorbs the spirit into itself again. And you ask, can chiropractic cure appendicitis or the flu? You have more faith in a knife or a spoonful of medicine than in the innate power that emanates the internal living world. B.J. Palmer. So this is what it's all about, guys. If we can keep that thought in our brains, everything that happens to us every day, we'll be in good shape. People are like, why does he have this map of Moncks Corner, South Carolina? Because we're going to talk about the different forms of intelligence in a second. And this slide right here shows that your educated intelligence will get you 0. Even though I'm doing a technique that's super intellectual and analytical, there's a lot of things you can't explain, right? So I show up to work today. I was running some offices in Charleston, South Carolina. I show up to work one morning, and there's a woman and her husband parked in front of the office. And they didn't have an appointment. And they come up to the door. We came in the back door. They're coming to the front door. And her husband is screaming at her. They're about it's a 90-year-old couple. And the husband is screaming at the wife. The wife's trying to explain things. They explained to me that over the last few days she had lost her hearing. And so the husband was really getting frustrated. He was screaming. She was trying to talk, but she couldn't hear anything. So she tells us that Jesus woke her up in the middle of the night. She drove from Moncks Corner, South Carolina, down to my office, parked the car in front of my office at 6 o'clock in the morning and waited for us to wake up. I mean, she didn't look at my address in a phone book or anything. She just showed up at the office. So they're screaming at each other. We do x-rays. We adjust her. She comes back the next day, her hearing's back. I mean, this was like, explain that, how that happened. It was just totally bizarre. Her name was Mildred Davis, 90-year-old woman from Moncks Corner, South Carolina, drove about an hour down to our office. So when you read Stevenson's textbook, they talk about different types of intelligence. So universal intelligence is a source. We think about that like as God, universal intelligence. And then the semi-source is innate intelligence. That's part of the universal intelligence that's within each one of us, okay? That's the semi-source. And then educated is the non-source, right? So let's say you have a baby come in and that baby has a fever. Kevin, when you adjust that baby, should the fever go up or down?
Go whatever it does, but it can go up.
You can read a lot of blogs though about it, right? And that's educated intelligence, you know? So there's so much spent in this area, it blocks these other two, right? So healing is all about the universal intelligence and the innate intelligence. We can overanalyze it, that's educated intelligence, but only innate and universal intelligence knows whether that fever should go up or down. The body's going to do it, we have to allow it to happen. This is my wife Carrie and I. We went to Alaska this summer. This is in Lake Skilak. It was an unbelievable place. That is alpine water that's coming out of these glaciers and creating this blue color there. It was really incredible. But I have this slide up because the next patient I'm going to talk about was in town for a wedding. And she came in, she's had severe headaches. And she's like, I'm in town for the wedding, and I'd gotten mature enough, Dr. Shreve, that if a patient came in, I didn't care if I was going to see him one time or 1,000 times, I was still going to do an x-ray. So I do upper cervical x-rays, and she's got, I got this bad headache, I got to feel better for the wedding. So we adjust her upper cervical and send her on her way. She comes back the next day for a follow-up, and she's like, what did you do to me? I'm like, what do you mean, what did I do to you? She said, well, I've had to use a catheter to go to the bathroom for 30 years. And I said, I woke up this morning, I didn't have to use the catheter. So we always have to think about how deep the stuff we do is. And it's pretty amazing. So this shows the vagus nerve comes out of the upper neck, has a big influence on the bladder. I don't know exactly what happened. Michael Longyear, you know, you can conceive of all these things theoretically that happen when people get better, but you don't know in the end, right? I can't explain to you exactly how that happened, but it was pretty cool. It was amazing, really. This is my family. We went on did a barefoot charter on a catamaran this summer. So that's my 19-year-old Ellis, myself, my wife Carrie, my son Colin, Tatum, Cameron sitting over here, and then Cal and Cannon, all right? And my kids all know this one. Mike Shreve, we're in the student union. Kevin, we're in the student union at Palmer. You're playing pool in the old student union. You look up, you just showed up on campus, and this is what you're looking at. Early to bed, early to rise, work like hell and advertise, right, Paul?
You got it.
So we're sitting there playing pool, drinking ball, and this one, anybody that went to Palmer when they had those old student union will never forget this, right? And it's true, right, Kevin? Early to bed, early to rise, work like hell and advertise. So at Palmer, there's epigrams everywhere that VJ had written. So with the CLEAR stuff, some of the stuff I wanted to share with you guys is stuff that they don't teach in school, Kevin. I mean, I would like to help these schools learn more about scoliosis, not necessarily from a treatment standpoint, because the stuff we do with the CLEAR Institute is like, you can't take a first try student and say, you have to go to the CARE Institute, or you have to take Dennis Wogan's problem, because it's just a huge thing. But there's a lot of things people can learn to better serve their patients. Like, I've kind of not kept up with chiropractic neurology, but Michael Longyear is near me. So if I have a patient that I'm not sure about, I have another chiropractor I can refer to that's a specialist, and I trust him more than any medical neurologist, you know. So we all have these specialties, and we should refer to these other chiropractors that have these specialties. So the timeline of the natural course of scoliosis. So what they don't teach you is that scoliosis is very unusual before adolescence. And then it grows through a potential growth spurt during puberty, and then again, it doesn't usually expand, okay? So if you're outside of those parameters, something weird is going on with the patient. We're gonna show you that in a minute. But you wanna really focus on that because you might have a 12-year-old that when they're 11, they had a 10-degree scoliosis, and then 6 months later, they have a 40-degree scoliosis. And you're wondering, what happened? What, did I do something wrong? You know, what's going on here, right? 80% of scoliosis is right thoracic, left lumbar. So everybody should be on board with learning these things so when they think these things is normal. So that's a normal pattern of scoliosis. If you see a left thoracic, right lumbar, and the patient has any unusual history, then there's a good chance they have a cyst or a tumor in their spinal cord. So you have to really look at those patients closely. 80% of scoliosis is in females. You might have known that. Scoliosis is only 5% in adolescents, but 60% in senior citizens. Why is that? Small curves become large curves. And I'll show you a picture of a patient Dr. Joe sent me, and you get these lateral eptheses at L3 usually, and it creates a lot of instability. And the patient a lot of times is going in for a chest x-ray or something, or they're getting a colonoscopy or something like that. And they'll say, hey, you have scoliosis. And they're like, what are you talking about? I don't have scoliosis. And the person's like 70 years old. And all of a sudden they have scoliosis. It's degenerative adult scoliosis. It's way bigger than adolescent scoliosis. It's a huge thing. It's very disabling, and it's something that people can be helped with. 80% of scoliosis patients have upper cervical ligament damage. I'm sure Dr. Shreve has been teaching this to people for a long time. But when we have birth trauma to the upper neck, and it creates alar ligament instability, that's your postural control center. So if you have that damage to your upper neck, you're more likely to have scoliosis. So if you have a severe scoliosis and you do alar ligament x-rays on that patient, there's almost 100% chance it's gonna be positive. The worse the scoliosis, the worse the alar ligament damage. And a lot of these things that we study, they're not like, the medical community is catching on to it. So they know about this upper cervical instability and scoliosis. At University of Washington, St. Louis, they actually had a pilot study to study this. It's that well known in the medical community. So we have to be careful that we are at the top of our game. So Dr. Fogarty was talking earlier about not watering down our CE standards too much, right? Because chiropractic should be at the pinnacle. You know, you don't want to give everybody the totally watered down continuing education hours, because we have to get better. Why? Because there's a medical community out there that's willing to take what we have. And many of you may have heard the story. Virgil String used to talk about, he was coming back on a plane flight, and the guy next to him was in tears crying. And he gets in a conversation with the guy. He was an osteopath, and they just voted to have a common board with osteopathic medicine and medicine. So basically traded in their license for medical license, but in the process, the osteopathic profession as we know it was given away. And now if you go to an osteopath, they're usually a primary care provider, a neurologist, an orthopedic surgeon, but they don't care for people like they did in the first part of the century. It's totally a medical model. They're mainly prescribing drugs and doing surgery. So I'm sure that they would be willing to trade the profession for that. Don't you think? You could find a pharmaceutical company, Dr. Fogarty, they'd all write us a check. We're in,
for years.
They'll give us a different license, and we're good to go, right? Retire, never have to work again. But there will be no more chiropractic. So it's a trade-off, right? How many times have you heard adjust the high side of the rainbow?
Yeah.
So I remember Dr. Greg used to have this video, and it showed a scoliosis spine. It was like the big thing they used to have in Michigan. You remember those big conferences they had? And it showed, they made this big snake of a spine, and basically each person was like a vertebra like this, and it was like a dance they had on this big stage. And they were trying to get the scoliosis to go away. And what it was showing was how specific a chiropractic adjustment could be. And they were trying to move these bones, and the scoliosis wouldn't go away. And then he moves this one transverse process, and the whole thing like goes away, right? it's not something where you can just pound on the scoliosis and the scoliosis is going to go away. If a person has a large right thoracic curve, which is your most common scoliosis, and you do a straight PDA adjustment, Pedimon used to talk about it's like a bucket handle. So if you have a bucket handle like this, right, and that bucket handle is over to the side, and you push straight down on it, which way is that bucket handle going to go? It's going to go further, right? So you can't be doing PDA adjusting on these thoracic curves. It's going to make the curve worse, right? So I can't teach chiropractors everything that we do, but I can tell you if you have upper cervical ligament damage, don't do diversified adjusting on their upper neck. If they have a large thoracic curve, don't do PDA adjusting. Don't adjust the high side of the rainbow, and the thoracic spine for sure. So timeline of natural course of scoliosis. So typically you won't see a scoliosis a lot in infants and toddlers. You're not going to see a lot. If you do, usually there's some kind of neurological pathology behind it, or it's developmental and it will self-limit itself. A lot of times it'll go away, right? So that's unusual. So this is a red flag in here. And then when you get into puberty, females hit it before males about 2 years earlier. You can see these progressive curves. Now, if you can reduce the curve down before they get into this period, a lot of times what I've found is the curve won't develop. And so what I've learned is the body goes through this thing called asynchronous bone growth when the hormones kick in. So typically, if it's a right thoracic curve, the bone will start to grow in the posterior right aspect, and it'll go narrow in the anterior left part, right? And when the hormones kick in, it only grows in that posterior right part. So then you start to get this bone deformation. But if you get things balanced out before that happens, then it won't occur. And in our office, we get quite a few referrals, patients 6 years old, 8, 9 years old. If you can get the correction at that time, then all these other things aren't going to happen. So it's real important to do it. And then when you go through the hormonal changes, you can get really some rapid changes in curves. So you can get a patient that goes from like a 10-degree curve to a 30-degree curve in like 6 or 7 months. And so it's important to know that it's not necessarily something that you did wrong. As an upper cervical chiropractor, you're not thinking you did something right, but if you're just observing the patient and they have this progressive scoliosis, it's just something that was almost like predestined to happen. The important thing is, as a chiropractor, is to realize what's happening, right? So if just by knowing this little bit of information, when you have this patient come in and they're 10 years old and they have a 20-degree curve, and then you take an x-ray 6 months later and that curve got worse, you're like, we need to do something like Ponto. This is like serious stuff. But it's not necessarily anything you're doing. This is like a pattern that if they have that predisposition for this to happen, it's going to happen, okay? It's our job to try to remove that interference to correct it. Then as an adult, the curve usually only gets a degree or two worse every couple years. And then when you go through menopause, then the curve will tend to get worse again. And this is where you get the older patients that all of a sudden they get the chest x-ray or the colonoscopy or something like that, and all of a sudden that curve trajectory goes way up again. So you'll see a lot of patients in our office are teenage girls, like 12 to 14 years old, or women that are like 65 to 80 years old, because those are the two groups where these curves are getting worse. In our office, we do something called mix, fix, set. If you're a Pedimon practitioner or know anything about Pedimon, you might be familiar to you. Mix is like a warming up of the spine to get it ready for the adjustment. Fix is the specific adjustment, and then set is specific neuromuscular exercises to get the brain to hold everything in alignment. So the first phase is warm-up exercises, massage. Therapy is designed to relax the muscles of the spine. Second phase is a specific chiropractic adjustment. We're using the Pedimon analysis system. So we're doing a three-dimensional upper cervical x-ray, alar views. If the scoliosis is above 25 degrees, we'll do lateral bending views to see what the potential is for the curve to reduce and get better. And so it's basically the Pedibond adjusting system with some more added to it. We're using the Pierce analysis, flexion extension. So a lot of it is based on ligament instability. Then phase 3 is getting the brain to hold everything in alignment. So it's specific neuromuscular exercises. So if you've seen Pedibond with the head weighting, so like a real simple example is if you put the head weight here, initially the body's gonna fall forward, but then there's the riding reflex, it brings it back. So we'll have them standing on an air disc on top of a vibrating platform doing that. But you can look at it from the A to P view, it's a lot more complicated. There's many things. You definitely don't want to take a simple Pedibond exercise and apply it to a scoliosis patient. So if you look at their posture and they're like this, and you go, I'm going to put a weight here and have them shrug it and stand on the vibe. The problem with that is if you look at the lumbar spine when they do that, you're making the lumbar spine worse. So you have to be very careful. We do an x-ray while they're doing the exercise to confirm it works, because even if you're good at it, you don't know it works till you see it working. And so in our office, we do wobble chair exercises, cervical repeat traction, Eckert table. They're placed in a mirror image of the curve. Cervical vibratory traction to bring the head back over the shoulder of the curved neck. Core stem is like a mini massage to balance the muscles out. Mechanical drop, if they're like a right thoracic, this is working on the right thoracic curve, bringing the head back over the shoulders, curving the neck. Me personally, this is my setup for my right thoracic curve, and I feel like I'm breathing pure oxygen while I'm doing it. So it has a great influence on your breathing. We do this specific adjustment, which is a combination of Pierce and Pedibond. Kyphosis restoration. If you look at a scoliosis patient and you put their hand between the shoulder blades, you'll see it's hollow in there, right? It's like a divot, because that curve's gone so far over, there's no more thoracic spine there. So there's studies in Europe where they have socialized medicine. All they do with a scoliosis patient is give them a thoracic kyphosis exercise. So they're doing like a resistance exercise like this, pushing their thoracic spine straight backwards against some resistance. And they show up at the place, it's socialized medicine. They teach them how to do that exercise. They tell the parent, do this 20 minutes a day, 3 times a day, and then that's it, they're gone. They never see them again. They know that if they have a better thoracic kyphosis, their odds of this scoliosis progressing go down. But that's all they do. It's crazy. Then the scoliosis traction chair, it looks a little medieval. It's actually comfortable. We have patients sit in there for 30 minutes. They're watching Netflix. I'll fall asleep in there. My family will attest that many times they found me sleeping in this thing. But it vibrates like the Vives do, but you're in a mirror image of your curve. So most exercise makes scoliosis worse. So if you watch a scoliosis patient do a pull-up, they're like this, right? So they're just programming in the muscles that are already stronger and making the ones that are weaker. So it's just making the problem worse. If you see them do a sit-up and you watch their belly button, you'll see the belly button go like this, right? So this allows the spine to exercise in a gravity-free environment, and it works really well. And then the last thing is, this is somebody with a left lumbar curve. So this is like the Pedibond spinal weighting, but it's a little more advanced. And so this, if we take an x-ray of Cameron doing this exercise, her spine completely straightens out. The curve is gone. So you're like programming that memory of the brain holding everything in position. Yes, Cannon, that's true. In the office, we also use Scolibrace. So we do a 3-dimensional scan of the body. It creates a hologram, and then it creates a 3-dimensional brace. It Velcros in the front, which is a lot better than the old Boston braces and Milwaukee braces. There's air ventilation, and it places the patient in a mirror image of the curve. They can move in the direction of the correction, but they can't move in the direction that makes it worse. And this is an example of the patient. They have a big left thoracic translation with a left thoracic curve. The brace puts them in the opposite position. 12 months later, you can see how they look. Their curve in this example went from 33 degrees to 11 to 6 degrees in 22 months. We're gonna go over a couple case studies. This is a 10-year-old patient that came in the office. She was 9 when she started. She was going to a local chiropractor. They recognized that she had a progressive scoliosis. It wasn't getting better. So when you're using a specialist in chiropractic, it's all about the patient. So if the patient is not getting better, you need to refer them out to somebody else. If I have a neurological patient and their seizures are getting worse with what I'm doing, I'm sending them to Dr. Lanier. I'm not going to continue to do something that's not working. So it doesn't mean they need to be sent to a medical doctor, but you can find a chiropractor that specializes in those things. I had the experience when I was in Charleston that I had a sprained ankle that just wouldn't get better. And I was playing rugby and it was driving me crazy. I went to this sports chiropractor and he adjusted my ankle like 3 times and it's always been better ever since that adjustment. So it's like we have to know how to utilize these specialties in chiropractic. So their chiropractor recognized that the scoliosis was getting worse. They referred her to my office. She went through 2 weeks intensive care November 16th last year. They got a Scolibrace. The patient and the parents were totally on board. So it's important to have that dynamic, especially with stuff like what Michael and I do, is if you pick up that the parents are divorced, the kid doesn't want to be there, it's not going to work. I mean, everybody's got to be on board when you're talking to them. And when the kid is sitting there saying yes, and they want to do that and they want to avoid surgery, you know, that's the first step to making everything work. So she did the 2-week intensive care, got the Scolibrace, did weekly visits for 13 visits. Then her next follow-up was March 2022. This is her Adams test. You can see the huge rib deformation that she had. Can everybody see that? And then these were her initial x-rays. She had a 17-degree left thoracic, 34-degree right lumbar, right thoracolumbar curve, kyphosis in the lumbar spine. So you'll see this a lot with the scoliosis patient. So the upper lumbar spine will be kyphotic, and then you'll see the thoracic spine go forward. If you take a lateral thoracic spine on somebody with a large curve, you'll actually see that they had a lordosis. When I was at Wogan's clinic one time, we had a patient with a 40-degree lordotic thoracic spine. She had an 85-degree scoliosis. But you can just look for that little tipping on your lateral lumbar. If that upper lumbar spine is going like that, and the patient's like 9 years old and you think the curve's progressing, that's one that could definitely get worse quickly, okay? So you gotta keep an eye on that. ALR views, she had a large curve, so we did ALR views. She's positive bilaterally, so we're not doing any exercises with her where she's doing cervical rotation. We're not doing any adjusting with her with cervical rotation. Dr. Shreve, if the patient was only ALR positive on the left side, then we would manipulate our upper cervical adjustment so we were adjusting on the left side. So like if your listing might be telling you to adjust right posterior and their left ALR, I'm gonna adjust left anterior because I don't wanna make that slippage worse. You follow it? Okay. So if you guys aren't familiar, anybody that's not familiar with those ALR views, so we're looking at the atlas on top of C2, and when they tip, right ALR positive would be the C1 going like this. Left would be going like that. So if the atlas is shifting this way, you're gonna make sure you're adjusting them from the right side. So if your listing might end up being right upper angle, right lower angle, but you're not gonna adjust from the left side. Now if you do a super non-force technique, you can still adjust from the left side, but you really have to be careful. And if you had some leg lengths that weren't balancing out or something like that, you might do that. This is an example of the spinal weighting. So she has the kyphotic S lumbar curve. When she has the anterior lumbar weight on, which is like a weight hanging here with the pad in the mid lumbar, that lumbar curve comes back. So that was her exercise in the office and the home, one of them. This is her in the scoliosis traction chair x-ray. So the 17 went down to 2, 34 went down to 0.5, 10 went to 5. So when we see this right off the bat, we're like, this is a good candidate. We're feeling really good about this. And then when we did her spinal weighting, she went down to 5, 0.6, and 4. So when we see this, this is like an optimal patient. This patient's motivated. The whole family's on board. They're getting these, so we're feeling really good about this. I'm already, when I see this, There's something called SOSAR, and it's an international scoliosis group that does presentations. I'm already thinking, this is my case presentation. So this is her in the chair. We did an x-ray to confirm, obviously. This is her doing her spinal weighting. And she's very small, so she's only doing 1 pound here and 3 pounds here. You don't want to exceed what they're metabolically capable of doing. So with her, it's going to be a very light weight, but you can see that's just 4 pounds that did that with her balancing on the air disc. It's pretty incredible. And so here are some of her follow-up x-rays. So the end of the intensive care, she went from 17 to 9, 34 to 25, 10 to 10. And then after we started seeing her once a week, she's still doing all her stuff at home, wearing the brace. She went to 7, 17, and 4. And then we actually just did another picture I'll show you in a second. This is her Adams test in March, though. So the rib deformation is gone. Really cool stuff. Now, something about the Adams test, like a lot of neurological tests, if it's negative, it doesn't mean anything. It's like, it's a whole picture. Like, you can take an x-ray on somebody. I just had a patient. The mother came in just to get a scoliosis x-ray. I did this test and it was negative. She didn't really want to get x-rayed. And I'm like, well, this is what the Adams test looked like. Scoliometer was negative. I mean, if you don't want the x-ray, and then she's like, okay, let's do the x-ray. We do the x-ray and the kid has a 20-degree scoliosis. So it's like these tests, you know, it's part of, there's a whole picture to it. One thing doesn't tell you everything, but this is incredible when you look at that rib deformation and you look at her age. So now the bones are growing. So this is like a whole nother level. We're actually talking about bones changing their shape before puberty sets in. She hasn't had her first menstrual cycle yet. So now, when that happens, everything's going to be growing in a straighter position. So we just did the x-ray on the 8th, and this is her new one. This is in the brace. The 3 went to, this is comparing the 2 brace x-rays, 3 to 0, 7 to 4, 5 to 3, and then this is her out of brace, 17 to 8, 34 to 13, 10 to 9. This is like an optimal case. This was like, she is so on board and so motivated. Really exciting stuff. She's gonna see, she hasn't seen the x-rays yet. She's gonna be so excited. She's like totally on board. While other professions are concerned with changing the environment to suit the weakened body, chiropractors are concerned with strengthening the body to suit the environment. B.J. Palmer. So we are unique. We believe in this control system and making this control system optimally functioning, and then the body's going to take care of itself and make these good decisions. This patient also had a scoliosis, but I'm mainly going to be talking about her lateral cervical x-ray. She came in with chronic migraines. She's on migraine medication, but she still has migraines, and she's still taking the migraine medication. It's like pharmaceuticals is like the weatherman, right? You only have to be 30% right and still be in business. It's like amazing. So she still has migraines, but she's taking the migraine medication, which is usually like Neurontin and these other things that are gonna really screw your brain up, right? And so I take the lateral cervical x-ray. I know you guys can't see over there, but when you look at the occiput and C1, the lines are like this. It should be, these two should be parallel, occiput and C1. Then her head is severely translated forward. She's got a complete kyphosis. So she's got a lot of pressure on her spinal cord. So you go to Mayo, you see the neurologist, you get all the imaging done, it's negative. Yeah. They don't understand this. It's crazy, but they don't understand what this means in a migraine patient. They just don't get it, right? So she goes through 2 months of corrective care. She also is unable to go to school because the migraines are so bad. So she's on medication, migraines, can't go to school. So she does 2 months of corrective care in her office. You can see the occiput and C1 are now parallel. She has the cervical lordosis back. The head forwardness is reduced to about 80%. She's down now back in school, no migraines, no medication, right? If she wouldn't have come into my office she would have been on that migraine medication and been partially in school like her whole life. You know, so we got a lot of work to do, Kevin. Where are the colleges promoting this? Come on, what are you guys doing? Let's go. Nothing in the world.
This is all my fault. I'm good with that. I take
Well,
full
you gotta
responsibility.
have somebody. He's got the most power of everybody here. We gotta put the screws to him. Nothing in the world can take the place of persistence. Talent will not. Nothing is more common than unsuccessful men with talent. Genius will not. Unrewarded genius is almost a proverb. Education will not. The world is full of educated derelicts. Calvin Coolidge. Dr. Wogan puts that up at almost every seminar he teaches, so I wanted to throw it up there in honor of him. This is another pre and post patient. She was under care for 2 years very consistently. When she started high school, it was hard for her to keep up with our program, but she was still wearing the brace at night. So this is when she was a consistent patient, wearing a brace most of the time, in school, still wearing the brace, up until from like 12 to 14. Okay, so the curve went from 18 to 21, 41 to 21. So when she first sees me, she's a patient in Nemours and they're telling she needs surgery. The surgery threshold is 40 degrees. So if you have a patient that has a 40-degree curve, one of the things you want to do is make sure they know that they have a 40-degree curve, and they need to know that seeing an orthopedist is something that you have to throw out there. Because from a medical legal standpoint, if you just have a patient that goes from a 20-degree curve to a 45-degree curve and you don't say anything to them and you just keep adjusting, you have to do something. You have to have a conversation with them, you know, and what we will see is chiropractors that just don't do anything. But when you have a progressive curve like that, you have to do something, right? And we get referrals from Palmer, Florida, when they have cases like this. And this patient went to Nemours. They were just telling him she needs surgery. I mean, you're 12 years old, you've had your first menstrual cycle, 41 degrees, you need surgery, this is probably gonna get worse. So she went through our program. 2 years later, 21 over 21, she's far from the surgical threshold now. So she doesn't come in the office for 2 years. She's wearing the brace at night. She's not doing her exercise. She's a competitive swimmer, which swimming is a risk factor for scoliosis. So I don't know, Kevin, if they teach any of this. There's certain risk factors for scoliosis. They did a big study in Australia, and they looked at people that had scoliosis already, like a 30-degree curve or more, and then they looked at what sports they did and which curves tended to get worse. It was volleyball, rhythmic gymnastics, and swimming were the three that made it worse. Why is that? Well, we talked about the PA on the thoracic. All those sports cause extension in the thoracic spine. So you're driving that curve sideways, right? So that's important stuff for us to know. It should be in the curriculum.
Jay, could people with scoliosis be attracted to swimming because they don't fall down?
Well, in the old days, well, I mean, there is a neurological thing like that, but I don't think in the old days, they used to think swimming made scoliosis better, but what it was in the pre-adolescent group, a lot of those people are gonna just get better. It's like innate is working and the body's going this way. You see these old Jim Gregg videos and he'll do this. And they're like, but the body is making these changes, they're adapting, right? So the body realizes the curve's going this way and it tells it to go the other way. So before puberty hits, a lot of times that's happening and the curves are just changing, right? So if that kid happens to be on a swim team and they go to the orthopedic surgeon, they're like, the swimming worked this time. It's like, no, the swimming didn't work. It was making it worse, but innate intelligence corrected the curve and they just happened to be a swimmer. But you see the picture of rhythmic gymnastics when the person's laying on their stomach, they're holding the ball like in between their feet and the ball's like up here. You guys know what I'm talking about? So they're on their back, they're on their stomach, their feet are like this, and they're holding the ball over their head. So they're in a complete thoracic lordosis.
Could you demonstrate that for us?
So they're in a complete opposite of the fetal curve. Everybody follow me? So that if they have any thoracic curve, it's gonna just drive it sideways. So rhythmic gymnastics is a big no-no for a scoliosis patient. So with literally no treatment except for sleeping in a brace at night for 2 years, her curve's now 14 over 24. her Adams test is negative. She had a huge Adams test too when she first came in. This is her postural x-ray, a picture the first 2 years, and that held. I didn't show you the Adams on that, but her Adams test got totally better. It is the set of the sails, not the direction of the wind, that determines which way we go. Jim Rohn. This is also a Dennis Wogan when he would put this in all his classes. But basically things happen, and it's how you react to those things and set the course, okay? So we have to realize that we can adapt things and make the best out of every situation. This is my daughter Tatum, and when she was 9 years old, we discovered she had scoliosis. We're like, oh my gosh, we have another one that has scoliosis, right? So we do some of our care with her, and she goes from 22 to 16, and then 16 to 10 degrees over this 2-year time. Now the cool thing about it, and Dr. Shreve will like this, is this is her nasium x-ray with the 22-degree curve, right? She wasn't compliant with her exercises, so it was mainly the upper cervical changes. So you look at, this is her initial nasium, so she had a 22-degree curve here. This is the next one, she had a 16-degree curve. This is the next one, she had a 10-degree curve. Right? There's a correlation between this upper cervical alignment and scoliosis. Life is the expression of tone. In that sentence is the basic principle of chiropractic. Tone is the normal degree of nerve tension. Tone is expressed in functions of normal elasticity, activity, strength, and excitability of the various organs and observed in a state of health. Consequently, the cause of disease is any variation of tone, nerves too tense or too slack. So that was what Dr. Lanier was telling us. This is a good definition of chiropractic when he spoke, so I had to dig that up. And Dr. Joe sent me this patient recently. This is one of those adult degenerative scoliosis patients, right? So when you look at these, you'll see huge lateral lethesis in these degenerative scoliosis patients. So what are their options? Suffer, get a multi-level fusion, but if you're 80 years old, that might not be a good idea. So these patients do really good with the lumbar scoliosis brace. When we were at Palmer, this would be like a knee chest Gonstead patient, which they will respond to that, but look how much ligament damage there is. It's hard to get that to hold in place. So the lumbar scolibrace is very short. It's like from here to here, and the older women don't mind wearing it, and they know it feels good. So we'll tell them if they wake up hurting, they'll sleep with it. They wake up not hurting. If they hurt when they're making dinner in the evening, they put it on like an hour or two before that, and it kind of breaks that chronic pain cycle. And I don't know about you, Dr. Longyear, but Keurig would have these, we'd have these lower back work comp patients, and he would cast them, like create these body casts, and they would wear these casts for like 2 weeks. And you would have these people that had been on disability for years, and all of a sudden they were better. And all he did was put them in this body cast. It basically, the body is compensating so much and working so hard, it never gets a break, that when you give it that chance to break and everything kind of resets itself, all of a sudden the person's better. And so the scolibrace is usually the shorter one in adults. It works really good. Colonel Sanders got rejected from 1,009 restaurants. Colonel Sanders was an entrepreneur. He did not become a professional chef until he was age 40. Didn't franchise Kentucky Fried Chicken until he was 62. Didn't become an icon until after he sold his company at 75. The tough times made him a tough person. I love this quote. Hard work beats all the tonics and vitamins in the world. Colonel Sanders. You guys like that? Basically, you can never say it's too late. There's always room to make things better, right? And when I was in Africa, I couldn't believe it. Kentucky Fried Chicken was everywhere. So before Subway, Kentucky Fried Chicken was the main provider of food in the world. So you'd be in these little town in Africa. Now the chicken wasn't as plump as it is in the United States, but they still had grease. So it was but you're like, there's a Kentucky Fried Chicken. This is like a dirt road in the middle of nowhere in Africa. There's a Kentucky Fried Chicken. Then I found out Kentucky Fried Chicken was the largest provider of food in the world. But now it's McDonald's and Subway. Subway has the most locations, McDonald's has the most food going out. Knowing our physical health and intellectual progress of this world and the next depends largely upon the proper alignment of our skeletal frames. Therefore, I feel it is our bounden duty to not only replace displaced bones, but also teach others so that the physical and spiritual may enjoy health, happiness, and full fruition of our earthly lives. D.D. Palmer. D.D. Palmer was he was like deep. So, but when I read that, I was just like, man, that is awesome. Feel free to contact me if you want to lunch and learn at your office, tour my office, or do any shadowing. That's my
Can you come
contact.
to my office and do a lunch?
Yeah, I'll come down there. And next month, I know we still got Dr. Shreve, but I just wanted to remind you guys, next month we have Haig John speaking on October 1st over at my office. And then we have Dr. Fogarty coming into town with Michael O'Connor on November the 12th. So we got some really good stuff coming. And I've already been in touch with Ed Cordero. He's going to be speaking at the beginning of the year. So there's some really cool stuff happening.